Healthcare experts acknowledge 46 million Americans are currently without health coverage. But Republican Congressman Tom Petri says the need for reform is exaggerated, with only about 15 million Americans really in need. He says an estimated 11 million are eligible for Medicaid but haven't applied, and the rest are between jobs or choose not to have coverage.
You have a lot of people who are not covered for one reason or another, sometimes through their own choice.
Democratic Congressman Steve Kagan is pushing the healthcare reform plan to ensure affordable coverage for all, including those denied due to one's health, a pre-existing condition, or inability to pay.
It's called no discrimination. It is a constitutional right that we fought very hard to secure.
Petri does agree with no discrimination, but he doesn't believe government should force coverage on everyone.
The idea that the government will be able to effectively regulate in the interest of consumers more effectively than consumers will when you're dealing with these big companies, I think is a false hope.
Well, I want to be perfectly clear. If you're happy with what you've got, I'd like you to keep it, but at a lower price.
Kagan says the reform plan would most benefit the poor and small business that currently can't afford to pay for workers' coverage by driving down costs.
This is about improving the quality of your care at a lower cost and making health care affordable once again for small business.
But Petri says penalties in the plan for non-participation would be lower than actually paying for coverage and keep people out of the plan.
They won't buy any coverage until they have a major medical problem, and then there is a requirement that people with pre-existing conditions be covered.